Hi, everybody. So this is going to be the last lecture for week 4, and this should conclude what you'll need to know for the third exam. In this lecture, we're going to be talking about equilibrium and human movement, as far as equilibrium, as far as what we see in human movement, stability and balance, and things like that. As always, at the end of this lecture, if you still have questions about this, you can come to the office hours or we can schedule a private Zoom meeting as well. So let's take a quick look at when we say equilibrium, what are we really talking about? And how can we use this to determine kind of the muscles that are used in movement and stuff like that? So let's take a look at kind of a simple arm curl, okay? Extension and flexion of the forearm. Let's indicate the elbow movement, all right? So if we're looking at kind of if we're measuring the amount of extension or flexion of an arm curl, when we're bringing our arm down, what muscle groups extend the elbow? So we're looking at our elbow extensors, okay? Mostly these are going to be our tricep brachii muscles, okay? When the muscle groups stop, what muscle groups might stop this extension? These are going to be the opposite. So these are going to be the antagonists to arm extension. So these are going to be our bicep brachii muscles, okay? So when we're doing elbow extension, our agonists are going to be our elbow extensors. Our antagonists would be our elbow flexors. Then when we go into elbow flexion, our elbow flexors, our bicep brachii muscles, are then the agonists, and the muscles on the opposite side, our tricep brachii, are going to be our antagonists. So these would stop the flexion. We can look at this again when we're looking at somebody doing a sit-up, okay? Much of the human movement involves a contraction of both agonists and antagonists. These are in direct opposition. So while the agonists are causing that motion, the antagonists are resisting that motion, or they may help control that motion. Because we find that controlled motion, once again, when we're looking at that summation of forces that we talked about earlier, good timing of the activation of these muscles is needed for an efficient or safe and effective motion. So during the trunk flexion of a sit-up, our agonists will be our trunk flexors, our abdominal muscles like the rectus abdominis muscles, and our antagonists would be our trunk extensors. A good example of this would be the rectus spinae group. So in what direction is the movement? It's counterclockwise. When we're looking at the sit-up, okay, we're looking at the sit-up, the person was moving like this, okay? It's counterclockwise, it's positive motion. So during this counterclockwise motion, the agonists contract concentrically, the antagonists contract eccentrically. And we measure the net effect of the agonist and antagonist moments, okay? When we say moments again, we have to go back to our angular kinetics. This is the moment of force, or our torques, okay? If the torque created by our agonist is greater than the torque created by our antagonist, we see this counterclockwise motion. If it's reversed and the torque created by our antagonist is greater than our agonist muscles, this will go either in reverse, okay, or it won't occur at all. So let's look at this again. We're looking at the flexion phase of the sit-ups. We're measuring the net effect of the combined flexor and extensor muscle groups, okay? So here we see our agonist muscles are producing this counterclockwise upward motion, and our antagonists are providing the opposite moments and torques. so that this can be a controlled movement, or if we're going down in our sit-up phase. So let's take an example of how we can look at equilibrium and use kind of the idea of biomechanics in rehabilitation. So let's look at somebody that had a knee surgery. We call it arthroplasty. Is kind of joint surgery, but it's usually surgery to relieve pain and restore range of motion. We look at either replacing or realigning the joint structure itself. So the goals of these are to restore function and relieve pain. If we're looking at osteoarthritis in the knee, they may go in and remove some cartilage in the knee that's inflamed, that's chronically inflamed or damaged. If the knee has been injured very traumatically, we may look at a knee replacement in general. So let's assume somebody had some knee surgery. After the surgery, or even before, we can look at how their gait is affected. And when we're looking at this, for this case, we see that the hip movements are similar between flexion and extension. They may even be more slightly elevated. And this could be due to that decrease in range of motion of the more distal structures like the knee and ankles, or it could be from pain. And when we're watching them walk, we notice that the knee has no extensor movement. Okay, so the knee injury could have been causing some pain during extension. Okay, during extension, the extension movement. So they're going to limit the amount of extension they do because that's causing pain. And then we notice that the ankle moments are similar, maybe a little bit more slightly reduced as well. So because of this knee pain, this person has learned to walk without their quadriceps, their knee extensors. Because the quadriceps are increasing bone-on-bone forces. This could be due to that osteoarthritis. It's worn away that cartilage. And so we're looking at bone-on-bone contact that causes pain. So we've gone in and we've probably done a total knee replacement. So after the surgery, she may have learned this pattern of walking either because of the residual pain or even weakened quadriceps now. And the increased hip extension movement causes the thigh to extend and almost lock the knee. And then the reduced plantar flexion movement reduces the push off and leads to shorter step length. So we need to look at, if we're looking at a rehabilitation scenario here, these are some things we might need to work on. So some suggestions for rehabilitation. Let's say that we've reduced that the surgery, and if she's on any medication for pain, the reduced pain allows us to go through some rehabilitation measures. Our first goal would be to strengthen the quadriceps, okay? Furthermore, when we're looking at retraining the gait pattern, we want to increase the ankle push-ups. We're increasing not only ankle strength, our plantar flexion strength, but our ankle range of motion as well. And we need to decrease that hip extensor movement or moment. These may fall into place with the kind of strengthening of the quadriceps. But the outcomes of these always depend on the patient's age, their lifestyle, general health, and state of the opposite knee as well. So let's assume we did surgery on her right knee, her left knee was fine the whole time, but she may have placed so much pressure and placed so much work on her opposite left knee that now her left quadricep group has become dominant. So we need to strengthen her quadriceps on the opposite side so that we have an equal amount of force from both muscle groups. So let's talk about stability and balance. Stability we're looking at as the resistance to the disruption of equilibrium. This is resistance to linear and angular accelerations. So once again, we're looking at kind of our inertia and our moment of inertia, okay? With stability, we're looking at being able to increase that linear inertia or the angular moment of inertia. With balance, we're looking at the ability to control, okay? Or basically maintain an equilibrium. So if you are on a boat and it's kind of rocky, we're looking at your balance. You're able to activate your agonists and antagonists, the neutralizers and stabilizers, in such a way that you maintain equilibrium. And so you're maintaining your balance and not falling to the deck of the boat. So stability is affected by four main components: your mass, the friction between the two moving objects, your base of support, and the center of mass location of your body. With mass, we're concerned with Newton's second law, or the law of acceleration, where we're looking at with an increased mass, force must also be increased an increased force is required to produce that acceleration. So if we're looking at sports where increased mass is beneficial, we might look at sumo wrestlers or football linemen, because they need a lot of resistance, okay, for no change in their linear or angular inertia, so that they can maintain stability when other forces are applied to them. If we're looking at other sports where a reduced mass is beneficial, we might consider gymnastics, pole vaulting, skating, or diving, where we're looking at the ability or the need to overcome linear or angular inertia very quickly, and increased mass would not be beneficial. So we're looking at reducing mass in these situations. If we're talking about friction, the greater the friction, the greater the force needed to initiate or maintain motion. Once again, we're trying to overcome that moment of inertia. If we're looking at toboggans and sleds, or even like racing ice skates, they have reduced friction for quick disruption of stability at the beginning of a race. If you really look at ice skates for racing, they are much, much more longer, but have a thinner blade. So they have a very, very low inertia. So it's easier to break that inertia and maintain a higher speed. Also, the Zamboni in hockey will go out and smooth the ice. What it's actually doing, though, it's actually placing a small layer of water on the ice, so the ice is actually smoother, so we see less friction of the ice. And if we're looking at, maybe we need to increase friction. If we're looking at a batter in baseball, they may wear batting gloves. And these are designed to increase the stability of the player's grip. And this is increasing the friction between their hands and the handle of the bat. So now let's look at base of support. Our base of support is the area enclosed by the outermost edges of the body, or segment of the body that is in contact with the supporting surface. So in this scenario, we can look at somebody standing on both legs and kind of draw their base of support and place where their center of mass should be. So right here, we've drawn a square around the outer edges of their feet. So this is their base of support. And then right here, right here is their center of mass. And we see it here and here. So a good way to look at this is, if you can't do it with your fellow classmates because we're not having classes, but if you're stuck at home and you've got, boyfriend, girlfriend, brother, sister, your dog that's wondering why you're still at home and you're really cutting into their nap time, you can kind of, not necessarily beat up on your fellow classmates, but kind of play around, keep it be nice to each other. Don't actually start slugging each other, but kind of both assume like an unstable posture and draw your base of support and your location of your center of mass on the floor. And then have each of you start kind of like lightly pushing each other. And notice how it's easier to push each other out of that base of support than if you're standing in a more stable posture. So you could be standing on one leg, you could be standing with your feet very close together for a while, and then you stand with both your legs, both your feet on the ground, or a wider stance, and notice that it's harder for you to lose your balance when you have a greater base of support. So let's look at some examples here. We can draw our base of support here, and here's our center of mass. Okay, for our two-legged stance. So that's where we have our two-legged stance. If we go into one-legged stance, our base of support is going to decrease, but our center of mass needs to be in almost the middle of the foot for us to maintain our balance. If we're looking at a martial arts stance, not only are we increasing the width of our base of support, but we're also increasing the length of it as well. This way, we're able to be more stable in both the medial lateral or anterior posterior directions as well. So we have an increased base of support in both directions, but our center of mass is still roughly in the center of our base of support so that we can maintain balance. If we're looking at a person with a walker, this is used when we're looking at more of a geriatric setting. They may have limited balance either due to some muscle wasting, we call it sarcopenia, so they need help with balancing. The walker itself is going to increase that base of support, but it also shifts the center of mass forward a bit. But the center of mass should still be within that base of support. If we're looking at animals, they have a slightly wider stance, especially bears. So they're going to have a very large base of support, but their center of mass is still in the center. But if we're looking at some sorts of sports and athletics, if we're looking at a dancer that's in an endpoint stage, their base of support is very, very, very small because they're basically on their toes here. And their center of mass has to be within this little tiny section. This is why when you see a lot of dancers, especially ballet dancers, they'll train their hips and legs, and even their lower leg muscles will be incredibly strong so that they can maintain their center of mass within that base of support. That's why they may have such superior balance. So if the center of mass moves outside of the base of support, balance will be lost or will be compromised unless the person or animal takes a step forward, backwards, to side so that they can place that center mass within their base of support. So with a larger base of support, it is less likely the center of mass will move outside of that base of support, and the system will remain more stable. So let's look at some of the positions of our center of mass. If the center of mass is close to the boundary of the base of support, we consider the system to be less stable. So athletes in a starting position for a race, let's say sprinters are lining up at the starting blocks, they put their center mass close to their base of support boundary, making it easier and faster to start the race. They're less stable, but because their center mass is so much more forward, they can start the race quicker. Okay, so there's a give and take here. So a center mass that's outside of the base of support may be more agile, but it's less stable. Alternatively, if a horizontal force is going to be sustained, stability can be enhanced if the center mass is closer to the base of support boundary, because the center mass will be displaced further before moving outside of the base of support. So sumo wrestlers, football linemen lean into their opponent. Now let's look at the center of mass in a vertical position. If the center of mass is higher, the system is unstable. The last lecture we talked about where a backpack is positioned. While we may see more torque on the lower back if you're letting your backpack hang below your butt, we're placing a lot of stress on the lower back. But if we kind of put it up too high, we've placed our center of mass so much higher, we've become a little bit more unstable. A horizontal force applied to a system with a higher center of mass has a greater moment arm, and this results in a larger destabilizing moment. So we can calculate the destabilizing moment for two different situations. Let's assume the axis of rotation is the far edge of these boxes, okay? And a 10 Newton horizontal force is applied at the level of the center of mass. The first box is 2 meters high, and the second box is 4 meters high. The 4-meter high box is going to be less stable because the center of mass is placed higher. So let's look at some of the principles of mechanical stability. By the way, this is a textbook by Hall. Full name is, I think, Susan E. Hall. She wrote a very good, it's an Intro to Biomechanics textbook. I think it's called Introduction to it's called Basic Biomechanics, excuse me. There's a few editions out there, but I've been, even when I was doing my undergrad and master's, we used this book all the time, and I still think I have the 3rd edition still. It's a great book to have, especially if you're considering a career in which you're using biomechanics. Even more so if you want to kind of increase your kind of ability with some of the more physics stuff. She does a very, very good job in explaining the mathematics of, linear and angular kinematics as well as linear and angular kinetics. She's got 4 very good chapters on this. So it's a good book to have if you're going to continue on in kind of biomechanics. So I definitely suggest picking that up. But when other factors are held constant, a body's ability to maintain equilibrium is increased by a few of the following. An increasing in body mass. It's very tough to do, but you can do that. We can increase friction with either gloves or cleats. We can increase the size of the base of support in the direction of the line of action of an external force. So we may increase our stance length or stance width. Think about this as if you've ever been out on a very, very, very windy day, you may develop a little bit of stance because the wind may be blowing you in one direction or the other. Horizontally positioning the center mass near the edge of the base of support of an oncoming external force. You're leaning into an opponent. Or with the vertical positioning of the center mass and keeping it as low as possible, kind of crouching, okay? Think of it like this: if you've ever been skiing or snowboarding, your stance, you try to kind of have a bit of a crouch in your stance, especially in snowboarding. You don't want to stand perfectly upright because you're going to be less stable like that. But if you bend your knees a bit and kind of get down and crouch a little bit lower, you'll be a little bit more stable on your board, which will help you in kind of learning and being able to avoid obstacles and such. So in quiet standing, just kind of standing around, how is balance achieved? The standing posture is mechanically unstable. Think of, you know what a pendulum is. You kind of got a bell around a piece of string and it goes back and forth like this. When we're looking at somebody just standing, we're looking at almost an inverse pendulum. So it's going back and forth like this. So just normal quiet standing posture is actually quite mechanically unstable. 2/3 of the body's mass is located in the head, arms, and trunk. So our lower body, especially the muscles and limbs of our lower body, have to be able to control that. This is why when we're doing balance assessment, A lot of times we'll use a force plate, and we're measuring the center of pressure of the lower limbs because they are in charge of controlling the upper body, okay? This mass is precariously balanced on top of just 2 relatively spindly legs and just 3 joints. So in order to determine the current state of balance or unbalance, the nervous system, your CNS and peripheral nervous system, must integrate the incoming sensory information from just your proprioception and visual information and just kind of any sort of vestibular when we're looking at the inner ear, and coordinate the descending commands to provide an appropriate correction while maintaining a stable inner limb coordination. If the nervous system is correct, it may destabilize the system, or if the nervous system is injured in any way, it may destabilize the system to a greater extent. If you've ever had an inner ear infection, or you know somebody that has, you'll notice that their balance is quite off because that's affecting the vestibular system. So they may lean to one side greater than the other, and that kind of makes them a little bit more imbalanced. So research has indicated that the complex balance system can be reduced to the examination of 2 variables, our center of mass and our center of pressure. Our center of pressure is what we measure when we're doing balance assessments, especially on a force plate or a force platform. Okay, so if we're looking at somebody standing on a force platform, it begins with their center of mass, if they're balanced, is right in the center. This is composed of this is basically the difference between your 2 feet while you stand in the center of a platform. As you just kind of normally sway, you'll see the center of pressure will start to meander around within your base of support. If it stays within this base of support, you're fine. But if it starts moving out of it in either direction, this is where we start looking at people losing their balance. And then we also look at, besides just where it's going, but how much it's moving. If we're seeing that's in a nice tight little area, that's usually indicative of good balance. But if we're looking at balance where it's spread out to a great extent, it's not hanging out in the center too much, this is where we might start looking at some sort of balance issue. So the center pressure, the location, it's basically the location of the ground reaction force, and its units are in meters. Some force plates will measure it in centimeters, but we'll stick with meters here. You can modify the center of pressure location by either plantar flexing or dorsiflexing the feet, or leaning or shifting your weight from side to side. When we look at plantar flexion or dorsiflexion of the feet, once again, if we're going back to snowboarding, this is how you turn on a snowboard. You either press your toes to the ground or your heels to the ground. If your heels to the ground, you'll turn to your left or right, depending if you're normal or goofy footed. But you'll put you in a lean backwards a bit, and you'll turn to that side. If you plantar flex, you're putting your toes to the ground, you'll move in the direction your toes are pointed in. So let's talk a little bit more about our center of pressure. The location of the center of pressure modifies the center of mass location. If your center of pressure moves forward, your center of mass moves forward, and the body tends to rotate about the ankles in quiet standing. Therefore, the axis of rotation is mostly located at the ankles. The weight force, or weight, and the vertical ground reaction force are equal and opposite to this. So once again, we're having a person standing. This is I can't draw a picture for some reason. You have a person standing, and this is the front of their body. This is the back of their body. Okay, if they lean forward, their center of pressure is going to go forward, but their center of mass is also going to move forward as well. If the center of mass moves outside of their base of support, they're most likely to fall forward. If their center of mass is moving posterior to their base of support and is going closer to the boundaries of that base of support, so center of pressure, or center of mass right here, they're more likely to fall backwards. Same thing with right and left. So let's kind of look at this as how a body sways back and forth and how this is controlled, okay? We'll say that once again, our weight is our vertical force here, and our axis of rotation is at our ankles, and our lever arm for our weight is greater than the lever arm for our normal force, our normal vertical force. Therefore, moment from our weight force, basically the mass of our center of mass, is greater than the moment of force from the ground reaction force. Okay, so in this picture here, we're seeing greater center of mass weight than the ground reaction force, and the body will accelerate in the clockwise direction. So especially when we're walking, we're accelerating our body forward, and the weight of our body accelerates us forward. If we start leaning forward again, you'll see this with some people standing too. They tend to stand with their body positioned further anteriorly. This is a very, very unstable sort of way to explain, or sort of a way to stand. But we've placed the ground reaction force now in front of us, okay? And then our center of pressure has moved forward from the last slide. So here, our center of mass, the force of our center of mass is less than the ground reaction force, and our body will accelerate in a counterclockwise direction, okay? And the COP is then moved backwards so we can maintain our position. So our center of pressure has to move backwards so that we don't fall forward. And then finally, we'll look at this one again. We have our center of mass is once again greater than the ground reaction force, and the body will accelerate in a clockwise rotation if we're leaning backwards. So the center of pressure has to move forward to maintain our balance. So here again, we've leaned forward and the body will accelerate in our counterclockwise direction. So our center of pressure has to move backwards, or else this person will fall forward. So therefore, the center of pressure must be continuously moving with respect to the center of mass. And we'll talk a little bit about this towards our last lecture when we start talking about variability of human movement. One of the larger areas in this is we look at the variability of the center of pressure. But in closing, we'll say that the center of pressure can be considered as analogous to a sheepdog, while the center of mass is the sheep. So our center of pressure must keep in check our center of mass, or we will fall over. This was kind of a short lecture, but the take-home points, and we'll discuss this in the review for the third exam, is that to maintain appropriate balance, your center of mass must be within the base of support, and the center of pressure direction indicates how that center of mass is moving within that base of support or outside of that base of support. I hope this was an interesting lecture. Once again, if you have any questions, please get in touch with me. Goodbye.